Good morning. Today we're going to talk about pain management at the end of life. Now, there are so many people that are afraid of morphine. They hear that word and it just puts them into a different plane of life, right? There's a lot of fear that comes with it because, of course, we hear the word morphine and we think all the things that we've heard around that are going to affect our loved one negatively, because most of the time what we hear on the news is negative, right? So again, I want to reinforce that morphine that is being used at end of life is for comfort measures only. And it is very, very low dose. It's usually only 0.25 on a syringe, on a 1 cc syringe. That's very little. And it's just 5 milligrams of morphine given orally. We usually will give it in the buccal or between the teeth and the cheek, and it is absorbed into that mucous membrane, and then it helps relieve some of that discomfort, pain discomfort, and it also is wonderful, absolutely wonderful medication for shortness of breath, or what we call air hunger. Now, not all people experience discomfort at end of life, so I want to preface that, but many people do have some discomfort. So when we are administering morphine, I want you to think of it like this. If you are a person who has been laying in the bed for any length of time, your body gets stiff, your joints get stiff, and then add on top of that, your body is actually starting to slow down and break down. So people cannot move in bed, they need supports in moving. That in itself can be very painful when you are caring for your loved one. So we will often suggest giving low dose morphine at end of life before you do any kind of personal care, whether you're turning them to take pressure off a certain area, whether you're bathing them or changing them. Administering medication 15 to 30 minutes before you actually do the activity will help reduce your loved one's discomfort during that process and that procedure. Now, for those of you who are confident that morphine hastens death, please hear me now. Morphine will help your loved one relax. Morphine will help your loved one breathe easier. And if they are having difficulty breathing, that produces anxiety. And so morphine can help reduce anxiety, because when you can feel like you can get a bigger breath, you're not as panicked. Now, there are other medications that are used. If somebody is truly allergic to morphine, they will use a Dilaudid or fentanyl. And again, medications are titrated starting at the lowest dose and moving up until symptoms are managed, and then we stop at that point. Sometimes we have to come back and readjust medication based on the patient's symptoms, but that is how we approach narcotic medication at the end of life. So I hope this clears up some of the misconceptions about morphine at end of life. If you find this information helpful, I would be very grateful if you would please consider sharing it, following me, and subscribing, so that I can continue to send this content out and help educate people, with my goal of hopefully reducing some of the fear that comes around end of life. Thank you so much for being here. Until we meet again, be kind to one another.